When you first come in for your total joint surgery, you'll be meeting one of our nurses who's going to be doing your intake, asking you questions about your medications and your medical history and the last time you ate or drank anything. And then you're going to meet your anesthesiologist. Your anesthesiologist is going to go through the consent for anesthesia, and many of the things that you'll talk about are the things I'll talk about here. The first thing will be what's called a block. If you are having a total knee replacement or a partial knee replacement, you'll be offered something that's called a nerve block. That's done in the preoperative space, so before you get to the operating room. You'll be given some medicines through your IV to help you relax, and then your anesthesiologist will use an ultrasound, which is a small probe that rests on the skin just above your knee, to see the nerves that go down to the knee. You'll feel a little pinch and burn of the local anesthetic to numb up your skin, and then some pressure. The block is long-acting numbing medicine that's going around the big nerve that goes down to your knee. Nothing stays in your leg. It's just a single injection of a long-acting medication that's going to provide pain control over the top of your knee for about 22 to 24 hours. That's done again in the preoperative area. Once that's done, you'll wait until your operating room is ready and it's time to go in for your actual operation.